Guyana does not conduct routine heart surgeries because of its lack of cardiothoracic surgeons, but 30-year-old Dr. Avlon Jeffrey hopes to be the change that turns the tide in the right direction. Dr. Jeffrey is a general practitioner at the Georgetown Public Hospital Corporation, where he has been employed for the last 4 years. He recently sat down with the Guyana Chronicle to tell his story of how he ignored the stigma associated with his community, Mocha, pushed to achieve his dreams, and is now reaching for more.
For me, it's always been medicine. I've always wanted to be a doctor. There was nothing else that I wanted to do. But particularly cardiology, during my years of study, there was a very big case, a very big accident, and we had a guy that came in and he had trauma to his chest, and his entire sternum was separated, and you could see from the outside, you could actually see in his chest, and you saw the dynamic of how the heart was squeezing. And for me, that was it. That was when I knew that the heart was, where I wanted to be.
At the age of 17, he left Guyana for Cuba to pursue his studies made possible through a scholarship from the government. It wasn't easy being away from his family and friends in a Spanish-speaking country at such a young age.
I studied in Cuba, Havana, Cuba, later on in Santiago. My years of formation, it was the same thing you hear from everybody else. Cuba, it's rough, of course. Being away from home, it's a culture shock. The food is different. The weather is different. It's a different language. It takes adapting to, but I wouldn't exchange it for anything. I had a good formation, I think. I think you need to just apply yourself, and you'll come out on top. You'll be successful. I've been to many camps, so initially I just thought of it as an extended camp. and I got accustomed to being away. Of course, I had my days where I just wanted to be home, be with my family, but you got to always focus on the dream. Yeah.
And we know a lot of young people, sad to say, they often romanticize the end result of being a doctor, but they don't often think about the journey and the challenges that they might be involved in. So can you think of one of your darkest points there while studying and tell us how you overcame that?
So while I was away, there were new additions to my family. My niece, she came into the world, and I wasn't there for that. And it was hard because even when I came home during holidays, I didn't have that connection because I wasn't there, right? But then you always got to focus on, why am I doing this? I'm doing this to uplift myself, to uplift my family. So my niece is going to see the benefit of me being away for a certain time.
After graduating, Dr. Jeffrey returned home to the limitations of Guyana's health system. At the GPHC, there are 2 clinics which manage heart patients, the Cardiology Clinic and the Heart Function Clinic. The hospital sees patients in relation to heart attacks, heart failure, congenital heart disease, and valvular heart disease, with just over 1,000 patients on scheduled visits for heart-related issues. However, the GPHC does not conduct routine heart surgeries.
You're only able to do so much and no more because, we're still very young in medicine. We still have a very far way to go. We don't do routine heart surgeries in Guyana. We probably do a few if we have a visiting team, probably from the US, Canada, wherever the case might be. So it's difficult to know that your patient requires more, but there's only so much you can do.
As it relates to heart surgeries, what does Guyana do?
We do simple procedures.
Oh, okay.
We might have a patient that would suffer a heart attack. We might be able to place a stent. We might be able to do minor stuff, but on a grand scale, patients requiring heart surgery, requiring probably heart transplant, those things aren't done here in Guyana. So, yeah.
Why not? And what would you say is needed to allow for Guyana to do so?
First and foremost, we don't have such specialists in our country. Like I mentioned before, those type of doctors would, come in on missions, or they're invited, by the government or whatever to handle these cases. We don't have a heart specialist of our own, a cardiac specialist, a surgeon. We don't have a cardiac surgeon of our own in Guyana. That's one of the areas I definitely want to pursue. That's actually what I want to do. It's my dream.
Looking back at his childhood and growing up in Mocha, Dr. Jeffrey realizes that he had to withstand the stigma placed on his community, financial challenges, and the guaranteed ups and downs of life to be able to stand where he does today.
I grew up on the East Bank, Mocha, some people know it. A village that, of course, has its stigma, but of course, it's my heart. It's where I grew, it's where I was born, it's where I grew up. It's a place that I feel safe. It's a place that I left home to go study and knew that my family was safe.
He does not believe that any child or youth should be disenfranchised simply for where he or she was born or what financial class he or she was born into. He encourages others who may be contemplating following their dreams to reach for it, despite the negativity that might surround them.
You have to follow your dream. I mean, even when I wanted to leave and study, persons, would have told me, you want to be a doctor for what? You have to hold on to your dream. It's not about people, it's about you, and it's about what your plans are for your future. Nobody's going to come and give anything to you. You need to go and pursue what you want. And by whatever means, if you need to leave and go and come back, scholarships aren't that bad. I went to Cuba. Leave. You will come back. And don't worry about the time. Time will pass, 6, 7 years. I'd rather spend that time following my dream than waiting on something that somebody might have promised me. So follow your dream, fight for your dream, and listen to that small voice in your head. The heart is what I love, heart surgery to be specific. My dream is to soon leave to pursue that. Of course, like everyone else, coronavirus has affected doctors too, right? Borders are closed, we can't travel, persons can't leave on scholarship and whatever the case might be. But yeah, that's my next big plan, to pursue my cardiovascular surgery program.
Okay. Yeah. And as you mentioned before, there are some shortcomings here in Guyana. But what do you believe must be done in Guyana to ensure that youths have better access to join the medical field? We know that you have to go to Cuba right now. Do you see a future in Guyana whereby we no longer have to do so? We can study right here in Guyana and produce even more doctors and nurses, etc.?
It could definitely happen. Of course, we have our university here, which is a top university in the Caribbean. But what I think we need to do, or what young people need done for them, is the lowering of cost. It's not easy to study medicine at home. I can tell you that. I started out at University of Guyana doing biology, but when it was time to do medicine, I couldn't afford it. So I had to take a scholarship. So I think if we can make it more cost effective for the youths that really want to pursue the area, that would be definitely a place to start. Offering scholarships to people that are less privileged, groups that are less privileged, doing programs, outreaches that would, bring young people out, have them pursue these areas. All of those are ways that we can tackle the cost and really get people into these fields.
As a doctor with a love for the heart, Dr. Jeffrey also left some words of advice to the average Guyanese. He said that there are many telltale signs for heart complications that persons should pay attention to guard against an impaired quality of life or even death.
And we have 2 clinics here at Georgetown that we manage heart patients in, the cardiology clinic, and then there's the heart function clinic. And in both of those clinics, there's almost or just surpassing over 1,000 patients with heart-related issues.
Would you say that there are a number of signs that Guyanese are missing that can prevent heart complications in the future, as well as alert them as to when they may be having a heart attack or something of the sort?
Definitely. One of the most common things we see is patients always ignore the symptoms that they have, whether it's shortness of breath, whether it's burning stomach, as we call it locally. They tell themselves it's gas. So, they ignore it, they leave it untreated, and as time goes by, complications such as heart failure develops. So that's definitely an area that patients may need more education, regarding, not to ignore your symptoms, use your primary health care, because that's one thing that patients don't do. Everybody comes to Georgetown Hospital. Nobody wants to go to the health center and so forth. But if we use our primary health care for our initial symptoms, I think we can tackle these complications that would arise later. Yeah.
And what about heart attacks? If someone is experiencing a heart attack, and maybe they don't know the symptoms, what are some of those symptoms that they should look for?
The common symptoms we see with patients are experiencing a heart attack would be the classic symptoms, I should say, would be chest pain in the middle of your chest. It could be a squeezing pain, a sticking pain, sometimes even a burning pain, like I alluded to earlier. It's a pain that might move to the left side of your arm. The arm might become numb. It could be associated with shortness of breath, sudden onset coughing, and so the case might go.
And are there any lifestyle changes that can help to improve the heart or heart health significantly?
Definitely. Diet is one of the principal things. I mean, today we look around and everybody's trying to get on a good diet plan, which is good, right? Because the more you alter your diet, the more you change it for the better, you're exposed to less risk of developing heart attack. Exercise is also good. Increase your tolerance, your stress level. Also controlling your comorbidities such as hypertension, use your medication, diabetes, you want to have these under control, because all of these can lead to a heart attack in the future. Yeah.
And persons often think, when it comes to the clogging of the arteries and so on, persons often think it's persons who are obese suffer with this, but would you say that any person, any weight can suffer from heart complications? Anybody
can suffer from a heart attack. Of course, there are persons that are more at risk for the heart attack, but anybody can suffer a heart attack. We've been seeing recently even the younger population suffering from heart attack because of alcohol use, drug use, recreational drugs, even marijuana. These can all precipitate these events that would cause an heart attack. So it's not just the obese, it's not just the old, it's not just the chronic smoker anymore. Of course, these are all factors that would put you at worse risk, but we see it in everybody these days.
Dr. Jeffrey recommends that persons should not wait until their conditions have far worsened before seeking medical help.
We have this custom in Guyana where we like to think we can weather the storm. We can take it more than, but patients need to stop waiting until they're at their very end to come to the hospital. We try our best, but for the want of better words, we're not miracle workers. You need to come at the initial stages, because many patients and their families wait until, they can't make it anymore, to say it like that, and then they show up. But, it would definitely help us help you if you, show up sooner rather than later.
Until the borders reopen and he's able to pursue his studies, Dr. Jeffrey urges Guyanese to stay safe during the pandemic, monitor their health through health checkups, and to reach for their dreams.